Hello, Dr. Rogers Lark. My name is Erin Clark, and I will be presenting my benchmark ethical dilemma presentation on the Whose Records video. So the ethical dilemma that was presented was that the client stated that the therapist was not a good match for her and wanted to terminate the client-counselor relationship. Also, the client wanted to review her records and notes from prior counseling sessions. The current problem is that the counselor continues to put down her client for previous counselor hopping. The counselor does not want to help her client terminate the relationship or further go over the records that was asked for by the client. So step one is identify the problem. So I would say the main problem was that the client wanted to terminate the counselor-client relationship, and that decision was not honored by the counselor whatsoever. The secondary problem was that the client was not given the right to view their records taken during the counseling sessions, which is a violation of HIPAA, which we will get into further in the presentation. The problems listed are related to the client's welfare, and the client's welfare was not taken into account by the counselor at all. The ACA standards and state codes that apply to the Whose Records video scenario include Code A11C, titled Appropriate Termination. This states that when it is evident that the client is not benefiting from the service, the counselor should respect the client's decision. Code B6E, titled Client Access, states that clients' records shall be provided to competent clients unless access to the records will cause harm. Code B6F, titled Assistance with Records, states counselors should support and advise their clients in interpreting their records. A state code that I applied to this scenario was Code 54.1, 2400 in Chapter 35 of Title 54.1 of the Code of Virginia. And this code states, when it becomes apparent that the client is not benefiting from the relationship, document the need for and the procedures taken to end a counselor-client relationship. When a counseling relationship ends, make sure to keep records of the help given and making the proper arrangements for the client's continued treatment. The federal state law that I applied to the scenario was the HIPAA 1996 Act, which is the Health Insurance Portability and Accountability Act. Under HIPAA, it is permitted for records to be disclosed to the individual who is seeking treatment, as long as the records do not cause harm to the client. However, in the Whose Records scenario, rather than the counselor showing empathy to her client and offering advice on how to end the relationship ethically, the counselor actually patronized her about her prior experiences with counseling. In the Step 3 Natures and Dimensions portion, the Whose Records video scenario violates not only one but many principles that include autonomy, non-maleficence, beneficence, and fidelity. Fidelity, in my opinion, is the priority principle that was broken. Without fidelity within the counselor-client relationship, there truly is no relationship, because fidelity is about honor commitments. Without fidelity, that involves honoring commitments, justice, beneficence, non-maleficence, and autonomy does not exist. The therapeutic relationship between the client and the therapist is widely recognized as one of the most essential components for good psychotherapy, since it is the greatest and most dependable predictor of outcomes, according to Scarvaglieri 2020. So a counselor that I would ask to help me in this ethical dilemma scenario would be Miss Olivia Withers. Miss Olivia Withers is an LPC of Fairfax, Virginia, and is a professional counselor who abides by the ACA Code of Ethics. Ms. Withers also specializes in behavioral, cognitive, family, marital therapy. I would also join the American Mental Health Counselors Association, and I will consult with the association to help me with ethical dilemmas presented in the scenario, because they strive to be a go-to organization for education, advocacy, leadership, and collaboration. The organization, I believe, can be used to find counselors in the same concentration and bounce ideas off of when needed. Potential courses of action that I would take to make the unethical situation in the Whose Records video more ethical would be to 1. Assure the client immediately that if they feel the need to terminate the relationship, I will walk them through the appropriate processes to do so without making judgment on my part, as I ethically should as a professional counselor. Number 2, as a counselor, I would thoroughly go through records with my client that I have kept from the beginning of our counselor-client journey. Making sure that the client understands how far their counseling journey has come can encourage a beneficial counseling relationship with another counselor in the future. Number 3, I will consult a supervisor if I am unsure on how to conclude the relationship professionally as a professional counselor. It is important to be able to ethically terminate the relationship, and a supervisor is put into place as an educational guide when needed. Number 4, I will create a cheat sheet to use during termination sessions after speaking with a supervisor. I will keep the cheat sheet with me on days when I know that I will be terminating a counselor-client relationship. Blease et al. 2020 says, even during the termination process, the therapeutic relationship can be enhanced by explaining the psychotherapy process to minimize patient anxiety and increase trust. The potential consequences of each action presented are: 1, the client can become angry that I have to go through a process instead of just ending our counselor-client relationship immediately. If that is an issue, I would then ask her if she would prefer that we go through the termination process at a later point to encourage a less stressful environment for both myself and the client. It may impact me professionally because it would be easy to just terminate the relationship to decrease risk and conflict. However, I have to follow the ACA Code of Ethics and terminate ethically. The second consequence of the action will be the records could reveal goals that the client may have had difficulty meeting, which could mentally put the client in a dark place. The client may feel that the records reveal negative in the counselor-client relationship that they did not know previously. However, as a counselor, reassuring that journey is a process and that you have to fall a little in life to get back up is critical to growth. The course of action can impact the client's well-being and self-esteem. And the potential consequences for numbers 3 and 4 would be there may be no supervisor present in the moment of need, and that could leave me as a counselor and the client stressed. Also, it would make it seem like I do not know how to do my job from the client standpoint. The course of action that I choose to take to ensure that my client is being treated ethically is I would ask a dependable supervisor who focuses on counseling to guide me through the termination procedure. Afterwards, I would set a day with my client to wrap up the counselor-client relationship. On the same day, we would sit down and review the client's personal records. I believe as a counselor, if I do not know how to properly do something, especially that will affect my client's welfare, I should consult a trusted colleague, or as stated in my presentation, I will consult a supervisor to ensure that I'm doing the right thing and also doing the best for my client. Also, on the subject of viewing personal records, under HIPAA 1996, if asked, and as long as the records do not harm the client has right to view them. Through evaluating the course of action, I believe the ethical dilemma would only exist if the client is asked to see the records and there are notes within the records that could potentially harm the client. However, if that is not an issue, I believe my course of action ensures that the client is heard and what is being asked of my client is also being taken care of by myself as the counselor. In the implementation process of solving the ethical dilemma within the Whose Records video, I would 1, meet with the supervisor to talk thoroughly about the termination process and the client's rights throughout the process. Number 2, thereafter speaking with a supervisor, I would set up a new appointment, which would be the last appointment with the client, to start the termination process. Number 3, during the termination process, I will show the client their records and we will thoroughly go over them together. At this point, the client will better understand the counseling process for future endeavors. Thank you, Dr. Lot Rogers, for listening to my presentation, and I hope you have a good one.